In this video, we'll talk about musculotendinous cuff. This musculotendinous cuff is also known as rotator cuff. So first of all, we must know what is musculotendinous cuff or the rotator cuff. So as you can see in the name, there is musculo and tendinous. So the tendons of the four muscle, they get flattened and they form a cuff-like structure around the shoulder joint, which is known as musculotendinous cuff or the rotator. So in this diagram, this is the lateral oblique view of the scapula, where you can see this is the glenoid cavity, and this is the bony part, and this is the lateral border of the scapula. Here you are seeing the muscle attached, the cut section of the muscle attached. This is your subscapularis muscle. This one is your supraspinatus, then infraspinatus, and this is your teres minor muscle. So these four muscle, their tendon get flattened and they form a sheath, fibrous sheath-like structure around the glenohumeral joint, and this sheath, it get blend with the capsule of the shoulder joint. So this form a cuff-like structure around the shoulder joint, which is known as rotator cuff. And this is the cut section of this glenohumeral joint, where you can see the outermost side. You can find this is the flattened tendon of the fore muscle, the same scapularis, supraspinatus, then infraspinatus, and the teres minor. They combine and they form a cuff-like structure around this joint capsule, that is your capsule of the shoulder joint, and this is adhered to this capsule. That is why it provides support and strength to the glenohumeral joint. So we will talk about the details of the muscles of the rotator cuff. So there are four muscles, and these muscles arise from the scapula. So out of which three muscles arise from the different fossa of the scapula. The subscapularis muscle, which arise from the subscapular fossa, that is the anterior surface or the costal surface of the scapula. Then you have supraspinatus muscle, which arise from the supraspinous fossa or the posterior surface of the scapula. Then you have infraspinatus muscle, which arise from the infraspinous fossa of the scapula. Then the fourth muscle, which is teres minor, which arise from the lateral border or the posterior surface of the scapula. So these four muscles, they arise from the scapula, and they in this you will find, you are seeing the muscles origin and the insertion. This in this diagram you are seeing the anterior view of the shoulder joint, where you can see the anterior surface or the costal surface of the scapula. The subscapularis muscle arise from this costal surface and get inserted into the lesser tubercle of the humerus. Then this is the supraspinatus muscle, which arises from the supraspinous fossa, which will be more clear on this posterior view of the shoulder joint. But here you can see the some part of the supraspinatus muscle, which get inserted into the greater tubercle or the upper facet of the greater tubercle of the humerus. And in this diagram, you are seeing the posterior view of the scapula and the humerus, where you can see the three muscles of the rotator cuff. This is the supraspinatus muscle getting inserted on the upper facet of the greater tubercle of the humerus. Then you have the infraspinatus muscle, which get inserted on the middle facet of the greater tubercle. Then the third muscle, which is teres minor, get inserted onto the inferior facet of the greater tubercle of the head of the humerus. So these three muscle and this subscapularis muscle tendon, they form a fibrous sheath, and they get blended with this capsule of the shoulder. They form a tough sheath, a tough cover around the shoulder joint. This is known as. So this is the same posterior view, in which you can see the origin and insertion of the different muscle that forms the rotator cuff. The tendon forms the rotator cuff. So the same, this is the supraspinatus, this is the infraspinatus, this is teres minor. They arise from the scapula. The supraspinatus arise from the supraspinous fossa. The infraspinatus arise from the infraspinous fossa. This is the spine of the scapula. So above the spine there is supraspinous fossa, below the spine there is infraspinous fossa. So these muscle arise from these two different fossa respectively, and they get inserted on the greater tubercle of the humerus. And this third muscle, that is teres minor, it is arising from the lateral border, and it get inserted on the inferior facet of the greater tubercle of the humerus. So in this chart, you can see the origin, insertion, and the innervation of these muscles which form the rotator cuff and their function. So out of this, all the muscles are rotator, like infraspinatus, teres minor, and the subscapular. They all rotate the arm, but this supraspinatus muscle that initiate and assist the deltoid in abduction of the arm, and also helps in rotator cuff muscles. So the basic function of the supraspinatus is in initiating the abduction of the arm, and while all other muscle, infraspinatus, teres minor, and subscapularis of the rotator cuff muscle, they rotate the arm. So now after studying the detailed anatomy of the rotator cuff, we must know what is the clinical importance of this rotator cuff. Any injury or disease may damage the musculotendinous rotator cuff, and it produces instability to the glenohumeral joint. And next is your trauma. Trauma may tear one or more tendon of the sits muscle, that is subscapularis, supraspinatus, infraspinatus, and teres minor muscle. Any tendon get ruptured or injured, and most commonly you will find the supraspinatus tendon is most commonly tendon that get injured after trauma. And in older people, you will find there is degenerative tendinitis that cause pain, and that causes difficult movement of the shoulder joint. So that's all about the rotator cuff. So this is all about today's video. Thank you.